The shortage of nurses, the shortage of healthcare professionals in this country is a health crisis. The issue of agency nurses existed for decades, but employers and unions kind of had a control on it. It was a one-off that if you were really stuck in a specific area, the employer would go and get an agency nurse. But since last fall, we've seen a spike of not only increase in usage of agency nursing, but also a number of companies just opening up and bringing their prices on. They all sign confidential agreement, and you'll hear that even from the employer association. The Ontario Health Association are saying they don't know. They know some employers use them, but it's all confidential agreements. So we don't know how much the hospital is being charged. Also, we don't know how much the nurse is getting. We've heard that it can be up 2, 3, 4 times the cost of a nurse. Even in Ontario recently, I heard the 4 times. So, that's over $200 an hour. But those are all anecdotal stories. And it's one of the reasons we've approached all the Auditor Generals in Canada to look into this, because it is public dollars going directly into a private company that we have no control and no transparency. Nurses are leaving our system to go work in agency because they want a break. They want flexibility. They want to know that at the end of their shift they leave. So these nurses are coming in. They're not engaged with their employer anymore. They're not part of the care team because it's a one-off, and they do their job and then they leave. So it's this lack of continuity of care and lack of team approach. Every expert has to get at the table, and that's why we're putting pressure on the federal government to do the same thing they did during the beginning of COVID. They took charge. They realized that COVID-19 was a health crisis. Now the shortage of nurses, the shortage of healthcare professionals in this country is a health crisis. And we need to bring the experts, bring the funding, and fund the best strategies